We will start with the after Secretariat's presentation, after which we would open the floor to take your questions if you have any, and then move on to our COVID-19 updates. So without wasting much time, I would like to invite Ms. Koza to brief us on the AFTA's upcoming events.
So what's important about this honor is that for the first time as a secretariat that's really starting out to effectively do its work, we've had a champion who held this organization together even before it was started and implemented. President Mohamedou Issoufou, as if you remember, he was appointed the champion of the secretariat. His role and his biggest task was to make sure that this secretariat is activated, and we found ourselves in this beautiful prime position where we can say from the 1st of January this year we started operating as an organization. Secondly, the reason why we're also honoring him is primarily because we believe strongly that he demonstrates the kind of leadership that we've been talking about, the leadership that is selfless, the leadership that wants to integrate this continent, the leadership that believes that the political emancipation that we've held for all these years, now it's time for the economic emancipation of this continent to be effected and for it to take place. But thirdly, we're also celebrating a man who understood that the task at hand is not just for this generation, but it's for the next generation. I like personalizing what we do and say, a couple of years from now, our kids, our grandkids will talk about these leaders, will talk about these champions, and will refer to them like we do with your own former president, the founding father of Ghana, to say they did play a part to make sure that we find the liberation and the freedom that we now celebrate. So it's important to really look forward. We're not looking back, we're not also looking at the present, but we want to celebrate that this president has done. Fourthly, which is a very, very big and important, is that from an operational point of view, I was not part of the negotiations, sadly. I'm not a trade specialist, I'm a diplomat and a communicator, but I was told that even at an operational level, he made sure that the agreement is signed. He made sure that things are done. So when people are talking about the fact that for the first time in a new organization, you've got 40 countries that have rectified the agreement, it's not been done out of a vacuum. There were men and women and being led by President Issoufou to make sure that all of this is done. The rectification of the member states enable us to really build into the dream of Agenda 2063, a united and prosperous Africa that we all belong and want to be part of. So what's going to happen this coming Friday to show the celebration and to show the honor that we bestowed to this president? We'll first have an official program that will start taking place at our own secretariat. The host country, which is the country of Ghana, this wonderful government has given us a building where we operate at the Africa Trade Building, and that's where the first and the only celebrations are going to take place this Friday. We have invited about 8 presidents. We've confirmed as we speak right now 5 presidents that will be coming to also be part of the celebration. We have the president of Burkina Faso, we've got the president of the DRC, who is also the chairperson of the council at the moment, the president of Togo, and the president of Nigeria. And importantly, we also have some of the presidents sending their own ministers to represent as part of the celebration, like the president of Ivory Coast. We also have 2 former presidents, the guest of honor himself, and as I indicated, the former president of Nigeria. I think what is also important, colleagues, is also to appreciate the fact that normally these ceremonial occasions, very few presidents will take time out to really spend and come and say to another former president or even a present president, job well done. But we see this being led by your own president, our host, President Anna. He is going to participate and be part of the program. It is an honor for us because we are hosted by you. We are hosted by this government. To see the level of participation and the level of support that we've received thus far, it's sincerely appreciated. And we want to say thank you, not only to the Deputy Minister and the department, but to the government of Ghana. We will have the formal program taking place at the first level at the conference center, as I indicated, in our building. In that formal program, obviously we will hear words of encouragement and celebratory remarks that will come from the different presidents, and the guest of honor himself will deliver the keynote address. Immediately after that, we'll go on the statue itself, where the statue will be officially unveiled, and the guest of honor will, for the first time, see this beautiful statue of himself. Some have asked questions, why are we doing this? Are we creating a cult of personality following? We're doing this because it's important. The history that we talk about, the history that our kids will refer to, it's a history that we are creating today to celebrate the leadership that we say. And that's why it's important. We want you and every member of the continent, when they come to the head office of trade in the continent, to see this beautiful statue of this champion and to appreciate that it was not a miracle. I'm a South African, and sometimes when we talk about even our own politics, we refer to the fact that there were men and women who dedicated. It's exactly the same thing that's happening. For us to find ourselves in this position where we're talking about creating, hopefully in the future, a one centralized union for the continent is because of the leadership of this kind of presidents that we have. So the statue will be a beautiful reminder that it was and it still is possible to have the kind of leadership that we are blessed with at the moment. Immediately after that, then the heads of states will be hosted to a lunch by our own president of the country. And that is also another example of the kind of relationship we have with the host country itself. Ladies and gentlemen, in a nutshell, that's what will be happening on Friday. But let me just take this opportunity, Deputy Minister, to also talk about this organization that I've referred to as the Secretariat. We are a hub, and we see ourselves as a place where each and every African who's interested in trade, including those who might not even be, to see the beacon of hope for an integrated Africa, to see an Africa that understands itself. It took more than 50 years for the EU to come together. It took us less than that. And it's primarily because of the dedication, the vision that the leadership of this continent has had. We might talk about political freedom, which is important. We wouldn't be here if it wasn't for that. But now we're talking about the transformation of our economies. It's important because all of us need to appreciate it is not a sprint, but a marathon that we together have to run. And we believe strongly that a partnership with our host country, that is going to materialize. Thank you, Deputy Minister.
Thank you so much, Ms. Koza, for that insightful presentation. And we also want to thank the Secretariat for spearheading economic transformation on the continent by facilitating intracontinental trade. On that note, I would like to invite questions, if any. So, colleagues, if you have, or friends, if you have any questions for Ms. Koza or the Africa Continental Free Trade Area Secretariat kindly show by hand so that we can take your questions and then go for her responses. Any question? Please, if there are no questions, I will use the opportunity to say thank you to Ms. Koza and also to Mr. Kandapa from the Africa Continental Free Trade Area Secretariat for joining us this afternoon. We hope to see you on Friday and also to participate in the ceremony. So thank you so much for joining us. So we now move to the second part of today's press briefing, which is to listen to the Director General of Ghana Health Service on COVID management and related issues, and also to take questions and go for his responses. Before he joins us on the podium, I would like to acknowledge some dignitaries who have joined us this afternoon. So as I mentioned earlier, we have the Director General of Ghana Health Service, Dr. Patrick Kumar-Boaje, with us this afternoon. We also have Dr. Bedisa Akodie, who is a consultant in public health, physician, and also at Ghana Health Service. We also have Dr. Asiedu Bekwen, who is a director of public health at the Ghana Health Service. So thank you so much for joining us this afternoon. On that note, I would like to invite the Director General to give us a bit on the COVID-19 management. Thank you.
Thank you very much, Honorable Deputy Minister, colleague directors, members of the media. Good afternoon once again. We've come once again to take you through the current update of the COVID situation in the country. I'll give you an overview. I'll talk to you about the epidemiology, the caseload in Accra, which is remains the epicenter, the school situation, and just a little update on Achimota situation, vaccination, and then the current outlook. That is a summary of where we are and what we need to do. There's been a gradual increase in the active cases over the past 4 weeks, as we are all aware. We have more than 2,000 active cases, and we have an average case count of about 120 cases, mainly in Accra, Greater Accra, and Ashanti. Severe and critical care cases still, however, remain low, but it's not like, let's say, 4 weeks ago. We are having some increase, but still not high. Greater Accra and Ashanti regions are driving the outbreak in the country. Almost all the cases are in this. Once in a while, we have a few cases in Eastern and other places. We have report outbreaks. Mainly, this outbreak has been more of clusters. We have them in schools and workplaces. For the past 6 to 8 weeks, we've not had vaccination, and that's one situation. And as we are all aware, adherence to protocol is generally low, and this is a call that we need to be able to take that seriously, especially in the wake of the current changes. So in summary, as at the 11th of July, we've had about 98,114 cases with 94,700 plus recoveries. We've tested more than 1.3 million people. As we speak now on our dashboard, we have 2,512 active cases. And as we understand, that is the number of people who are currently carrying the virus, with overall positivity rate of 7.3%. We've had a death of about 806. The last time I was here, the death was about 799 thereabouts. So we've had about 6 more since the last time we updated the data. Just a summary to just show you that it's a Greater Accra and Ashanti region is where we have most of the cases. The next epic curve, which I'm sure we are now, our journalists are all getting used to understand. You can see that in the last few days, there's a slight increase in the number of cases. We are hoping that this we are able to control this by adhering to the protocols and bring it down. At the same time, you can see the number of active cases going up. We peaked about 8,000 somewhere in February, March this year, but we are also starting a rise to about 2,500, as I mentioned. Because the numbers are, the tests are usually batched, the number of the reporting may not be exact, but if you have a 7-day moving average, you can see that even that also shows that our numbers are increasing. So that's it for the general population. But when it comes to the arrivals, we also started seeing a slight increase, which I'll show you later. We've so far had about 1,997 people testing positive on arrival. We've tested more than 366,000 people. Positivity rate is lower than the general community population, which is about 0.55, and the males account for the larger proportion of the cases. If you go to the next slide, you can see that I'm sure you saw when we had the spike, the India, Dubai spike, you saw the increases of the was picked up. You can see that we have also been seeing some slight increase in the report at the airport. The last time we were here, we explained to you that we have an outbreak in the sub-region in other countries and most of Africa. About 50% at the time of all the positive at the airport came from two countries, Sierra Leone and Liberia, and we mentioned them so that we are all cautious. So far in July, we have reported 100 cases compared to 144 in the whole of June. We are still not in the middle of July yet. So the projection is that they are likely to report more cases than we reported last month. But that also tells you that is sensitive to the changes around you. And so as they have spikes around you, you also see that more cases are picked at the airport. Okay, so in terms of the caseload, you can see that okay, let me use this one. Admissions in Greater Accra, you can see there's a slight increase as you go on. The critical cases are not significantly increasing, but it tells you that we are having some surge in the number of cases, which is of course represent a proportion of those who are positive. So what's happening also in our schools? A total of 363 schools have recorded cases. We have so far cumulatively recorded 2,323 cases in our schools since school reopened in January. 92.8% of them have recovered. There are about 166 active cases among students in 4 regions. That's Ahafo, Ashanti, Greater Accra, and Eastern Region, and 1 case in Oti. Overall, in the schools, Volta region has recorded the highest number of cases, accounting for about 512 cases across since school reopened, whilst Northeast has not recorded any case since school reopened in January. The next table just gives you the details of the number of cases per region. I think the last time we were here, we spent a lot of time on Achimota, so we just want to give you an update on where we are. In summary, a total of 1,173 students and staff have been sampled and tested in the school. The result available is 1,157, so that's nearly all. And we recorded 195 positives, and that's also part of the numbers that have caused our active cases to go up. 157 of them were boarders, 32 were day students, and 6 were staff. and 120 have recovered, and we have an active case of 75. Some of them are being isolated in school. Very few are home, and then the rest are also at the National Isolation Center in Pantine. But that tells you that the appearance of protocol in a large cluster like where schools is extremely important, because one case can just spread very rapidly. And for a school that has day school, that will also be a possibility of spillover into the community. So we need to all be careful. So what have been the details of testing as of July in the school? So as we said, routine testing, we had done suspected cases 539, and we have what we call strategic testing, because the event of the Delta, we needed to ensure that we have a different strategy to quickly contain it. So we did what we call strategic testing, which is outside our clear policy. That's why we tested all day students and staff, just to make sure that we are able to contain the condition in the school. Out of the 634 strategy, we had 36 positives, and then 13 of them are still pending, because we continue to take some samples still. So like I said, 14 of them are at home care. 145 of them have been isolated in school. Some of them have been discharged anyway back to school, and that gives the total number 159. 107 has recovered. Those in isolation, those are in the home care, 13 have recovered and have come back to school. And then so we have a total active cases of 39 currently, for that's the one at home and then the 38 in school. I think we are all aware that we have, in the last 4 weeks, we have been experiencing an increase. And of course, with the fast-spreading Delta also becoming part of this, and a lot has to be done. What we are doing is enhancing risk communication, and we are providing information about the areas of protocol, mask wearing, which is very, very low now. You go to town, I don't see anybody wearing a mask. The social distancing and avoiding the large crowds. This is something that we need to do, and this exercise is part of what we are trying to do, ensure that we as media men also remind people about the importance of protecting, because this disease, you need to have an individual responsibility and community responsibility beyond what the health sector will be doing in terms of providing you the public health measures that are used to apply to prevent spread. We are also identified COVID champions to really support and adherence of the protocols, and so very soon we're seeing a few more people who will be part of the discussion to encourage more people to wear. For the schools, we are engaging stakeholders. We've engaged a few PTAs, religious bodies, organized groups, to ensure that we enhance the use of the protocols, especially in workplaces and in schools where we felt that some of them are relaxed. We want to enhance triaging in health facilities, so that where people come with respiratory conditions, they are quickly isolated and tested or tried before they are added to the general population in the hospital. We never close down our holding centers. We are holding them at bay in case, but we are hoping that we don't get there. So that's why we are asking that everybody adapts to the protocols that we have experienced, that we have been sharing with you. As you can see, we are doing more testing because we have also enhanced our contact tracing rapidly to be able to contain and reduce the spread. Like I said, we are having more cluster spread now, but if we are not careful, we will move into generalized community spread. That's why we have a major spike. So let's try and contain where we have. Vaccination is an important aspect of the containment of this disease. And so far, we have vaccinated 1,271,393 people. Breakdown is that of this number, 865,000 plus have had one dose, and 405,000 plus have had their second dose, that they are fully vaccinated. What we are looking at is the difference of almost 400,000 more people who needs to be vaccinated, given their second dose. Okay. So I just move to the next slide of what is our preparation for further vaccines. Vaccines, we are expecting about 1.2 million Pfizer vaccines from COVAX through the US through the COVAX for us, and we are hoping that later by middle of August it should be available for that. We also, as mentioned earlier, about 250,000 doses of AstraZeneca will be coming in for the second dose of those people, but obviously we continue engaging other options to ensure that we have enough to cover all those who are waiting for their second dose. For Johnson & Johnson, we have an agreement with AU for about 17 million doses. We are expecting that by middle of August or end of July, we actually mentioned that maybe by end of July we may get some sample. But I think because of all this schedule and changes, we are just making it tentative. But if it happens, that's what we are all hoping for, so that we can start giving some Johnson & Johnson as part of the dose. But to prepare for more vaccines, we have had to upgrade our cold chain facility, especially the ultra-negative cold chain, which can store Pfizer, Moderna, and the other newer vaccines that we talked about. So far, with our collaboration with Zipline, we have the capacity to store about 1.7 million doses out there. Yesterday, we received 16 ultra-negative cold chain vaccines that will be distributed to all regions to ensure that we are able to vaccinate all people. And then we are expecting additional deliveries of delivery vans and fridges bought by the government to augment our capacity across the country. So, Honorable Deputy Minister, in summary, ladies and gentlemen, our outlook is that the active cases have seen an increase in the midst of peer adherence to the COVID safety protocols. The Delta variant presents a threat and is currently a threat, and that is probably leading to the wave that we are having. And so we do not need any additional protocols because we have Delta or anything. All we need to do is to continue with our wearing of our mask, ensuring that we do our social distancing, we are clean, washing our hands, or using sanitizing our hands, and avoiding crowds. And I think with that we can break the transmission in Ghana. Thank you very much.
Thank you so much. And thank you for the wonderful work that you are doing for Mother Ghana. And I'll only add my voice to Ghanaians, to what you've said to Ghanaians, that we all need to adhere to the protocols to ensure that we are able to bring this COVID situation under control. And on that note, I would like to invite questions, if any, and then go to Dr. Patrick Kumar Boaji for his responses to the questions. Please, if you have a question, kindly raise your hand. Me pacho se opese obisa asema mpacho maonsa so na yemfre obisa wasema ewi ane koje anu yi wo Dr. Hono Mabrel. Any questions, please? Yes. Your name and media house, and then you proceed to ask your question.
Good afternoon, Abu. Pastor Femi Puku, Ifri Kingdom FM. My question is, you say free my COVID ne Australia president ba now addressing on how you share who by free time who say new variant by Delta variant by NT president nka. Se be say if the health team no in the MVP president in here and I did in nama president acha as I want me address this nation. But that's it.
Sure. Please go ahead.
Good afternoon, Honorable. My name is Paul Nyedalfo. I report for Daily Statesman. And my question is, we understand the Delta variant is one of the fastest spreading virus in Africa and the world as well. I want to find out from the Director General as to whether we are up to testing the general public to ascertain what will be the results. Thank you.
Please, if you can, Odop, you got the question. Did you get his question?
I got the question.
Okay, thank you. Please go ahead.
My name is Al-Hassan Membasir, reporting for Marhaba FM. Marhaba FM, Hausa speaking radio station. I would like to ask, with the different brands of COVID-19 vaccines, how is the efficacy? That's what I would like to know from you. And thank you very much.
I'm John from Finder. Doug, please, we are hearing that our ICUs are coming full. So my question is, how are our facilities coping with it? Thank you.
Okay, so we'll take the first set of questions and go for responses and come back to you. Doc,
Thank
please.
you very much. I'm sure the very first question. First question, the MC message, you know. Me sure say President Betty. Say also kasa obekasa. When I'm saying at Delta and can't start a boy home and boy home. Yes. Our tests so far, our tests is able to, we have actually expanded our testing. Currently we have about 43 sites that can test COVID across the country. We started with 2. And whether it's Delta, Alpha or Beta or whatever, the tests are efficient and they can actually test and identify them. So on the issue of the efficacy of the vaccines, yes, they are all, currently all vaccines are able to deal with all vaccines, all the variants, including the Delta. And one thing I mentioned yesterday is the fact that for the number of people who are, as it were, falling sick severely and getting admission, none of them is vaccinated. And so that tells you that the vaccine is really protective. And so whether it's Delta or not, they are not vaccinated. And it's a global information that it works for the efficacy all for them. Not all vaccines have the same level of sensitivity. Some of them are 94%, some of them are 76%, some of them are even in their 50s. But once a large number of people are vaccinated, they are protected. Our ICUs are not full. Let me give an example. Ridge has 16-bed ICU. As we speak now, there are only 3. I wouldn't say only. There are 3 cases there. Yesterday there were 8. There are 5. Yesterday there were 8. 3 have been discharged. 2 more have been discharged today. And so that's what brings the number to about 3. Ghana East has about 19 cases currently on admission, 6 in ICU. We have more than 20 ICU beds in there, so it's not full. These are just the 2 areas I can talk about. There's a plan to upgrade further with support from the COVID fund, increase the ICU capacity at Ridge Hospital very soon to add that. So both Accra and Kumasi, yes. Like I said, the critical cases have increased, but we are not overwhelmed yet, and we don't hope to be overwhelmed. And our ICU beds are not full. Yeah, the last time there was some circulation going on, there is enough oxygen for the current cases that we have there. So that's just to let you know. So ICUs are not full.
So please, we'll come for the next set of questions, if any. Please go ahead.
My name is Kweku Asante, Joy News. So I have two questions. One for Director General on our testing capacity. Currently, there are those who have said that if we were testing as we used to, we'll probably detect more cases. So what is our current testing capacity? I mean, especially the gap that people have said exists now between what we are doing now and the past. And then the second one is to the Deputy Information Minister on the attacks on some journalists in the country. Just this week, Kennedy Japan Honorable have threatened a multimedia journalist, asking people to beat him up. We've not heard anything so far from government. Is there anything the Deputy Minister want to share on that? Thank you.
Yeah, good afternoon, Dr. Awaji. I read a piece a friend sent to me. A doctor in the US is saying that in 2 years' time, those who are taking the medicine, vaccinating, may get some side effect. It may be very disastrous. I don't know if that's come to your notice. If that's the case, how do we deal with such a situation? And then, Deputy Minister, I want to find out, because the President said that when you're organizing funeral, only 25 people should go. Church is 2 hours. But like you're saying, today people have flouted the law. Some judges are going beyond even 3-4 hours. And nothing's happening to them because the President brought EI, as it were, to regulate some of these things. But it looks as if everything has been left haywire. So what the government doing, as it were, to bring back some of these things so that the incidents will go down? And Dr. Aboidi, my second question. From what we are seeing now, are we going to experience a third upsurge? Do you anticipate that? Do you foresee that coming? Thank you.
Please, we will take, okay.
Good evening, Akokraba Kasapa FM. Sir, Chairman of the ECOWAS Committee, President Nana Danko Kufuor, say African countries in Yamamodini Asibitimi are self-sufficient to manufacture vaccine. I think so. No, nominate and they vote you into UN Security Council. No, for Shelia Yakubuchi can say Adiaba Kumbutima na Omabuani say Africa bitimi a manufacturing vaccine. Yibisa say. Director General for Ghana Health Service, ye process and simple no medical come say the be between ye vaccine no akwa kwisi let's say.
Okay. So
thank you very much, Honorable Minister. Yeah, our testing capacity. I mentioned that we have moved from 2 testing sites about more than 43. Our ability to test is enormous, both public and private. I will not be able to tell you in terms of figures, but I think we have excess capacity in testing. Testing comes with a policy. The policy of testing is that you have a case, you do their contacts and you follow up. Our studies from the early phase of the initial search give us an average of 11 contacts per person. So if you are getting 800 cases per day, the total number of tests you do is certainly going to be more than if you are getting 100 or 120. So the testing we are doing is still sensitive enough to pick up the cases. That's why when there's a wave, we pick it up. And once you start picking a case, you go around and test them. We had a few cases in Achimota. We've done nearly 2,000 tests. And all of them, results came within 48 hours. And so that tells you that our testing capacity has increased and also become very efficient. So I don't think that because you are having a wave now, we should just pitch camp and start testing everybody. I don't think that people like to be tested. I don't know whether you have had a test before, and when your text message comes, how is it to open your book, your phone and check what the results are? So we have a policy, and that's what we are following. Well, I don't know whether the American doctor told you how he got his information from what will happen in 2 years. I may know 1 year, but in 2 years. Yeah, every medication, I'm sure, if you buy paracetamol and you pull out the leaflet in it, you see the list of side effects that is written. It is possible that there is side effects. We've seen some here. We've told you which ones they are. But nobody can forecast that there is something serious is going to happen. And this have been tested, and this is not new. This is global system, so I don't believe that it should fall for those speculations. Yes, the protocols, I believe that we all have an individual responsibility. I'm sure now when you come to town, you don't spend more than 2 hours. I remember you told me that you can't wear mask for 2 hours. I don't know, we have some experience now, but I think we all have to adhere to the protocols. The mask wearing, hand washing, especially workplaces. Let's make sure that we have done the decongestion, we have the sanitizer at the right places, the flow of people are also controlled. In schools, the number of people go to dining hall at a time. We have said parents or people should not visit boarding schools, all the same to ensure that these things are help us. And so yes, there's a surge. Whether it's going to be a third wave or not depends on what we do. If we abide by the protocols, this can be averted. I said that currently it's in clusters. If it's in clusters, it happens in a Chimota school, it happened in another school in Kumasi, it happened in some hospitals, it happened in a workplace, and they together account for the number of positives that we have received since so far. But if we are able to adhere by the protocols as have been prescribed, we as a people will be able to avert a third wave and also save all. Of course, the next most important thing is provide our self-immunity by making sure that we have enough vaccines for everybody. And that's how, despite the wave in some countries, they are able to contain the number, because a significant number of people have been vaccinated. And that's our aim, to ensure that we get vaccines for everybody. Vaccine production, there's a lot of work is going on. Vaccine production, I don't think is just something you do in a very short time. It requires a lot of research, a lot of energy. There's a committee and there's a group that's currently working seriously to ensure that we have the capacity and the systems in place to produce vaccines in the medium term to come. Not just COVID vaccine, but other vaccines, and that's what their mandate is. So thank you very much.
Thank you so much, Dr. Kumar-Boaji. But I think there was one question that was addressed to me in relation to the safety of journalists. And to my good friend, in response to your question, I would like to remind you that quite recently, just a few months ago, the Honorable Minister for Information went to the NMC's old office to launch the Office of the Coordinated Mechanism on the Safety of Journalists. It's in anticipation of some of these allegations or threats or alleged threats that the office was set up. My understanding is that your institution has already reported this particular issue to the NMC and also to the police. We have set up these institutions, and it is our belief that some of these issues that you have already referred to them will be addressed properly on those platforms. Thank you. Please, we'll take the last set of questions, if any. And if there are no questions, I would like to thank Dr. Patrick Kumar-Boaji and his team for joining us here at the Ministry of Information this afternoon, and to my friends who are here to ask questions and also to engage Dr. Kumar-Boaji, and also our earlier guest who came from the Africa Continental Free Trade Area. I say thank you and good afternoon.
Well, thank you very much, Honorable Minister. And I plead with our colleague journalists that please, let's preach adherence to the protocols to help all of us. Thank you very much.
Thank you.
Assembly,